TNF-B factors and all the interleukin factors, which affect basically the
Χριστό μαζί μας, τον ευλογημένο.
This is Chris around 3 months ago,
Και τι άλλους να πούμε.
2025.
Χριστό μου, καλό ταξίδι.
Have a nice trip, and you can see
Chris from the United Kingdom, from Palmer's Green.
okay, that's that one. So it's very important when you're targeting to know where you're targeting and why you're targeting. And that's why at Sozo Brain Center, we utilize a clinical examination, neurological. We brain map them with our neurophysiologists. We use QEEGs. Now we're using AI systems, where basically the AI feeds into the patient. And with that, we have a treatment protocol, a montage. And we can use a combination of tDCS, TAVNS, TPS. So this is a stroke patient. This is one of the ones I was going to present to you, but I said to use a few other cases. He had a severe hemorrhagic stroke. He's a businessman, very successful in Germany, and he has severe problems with the cerebellum, vertigo, balance, and walking. And he's very frustrated. He's consulted multiple rehabilitation clinics, multiple neurologists. He's been doing all the protocols using neurofeedback, but nothing. Let's see what we've done for him.
He was a champion surfer, number 3 in the world from Germany.
When he was young, he was a surfer as well. So you can see the severe edema,
very physical,
atrophy of the brain. You can see the sulcus, and you can see all the region of the parietal, all the way down the cerebellum has been affected. Now let's see the patient.
Lower motor neuron. Upper, problem from there up.
This is in Germany. We were invited by the vice president of the German oncology.
See? Upper.
He's got an upper motor neuron, and also he's got cerebellar ataxia. He can't smoothly glide.
He cannot do it. Not even the right.
Now, when we target the patient instantly, he walks for the first time without a stick.
That's it. That's
This is not more.
He's walking for the first time.
15 minutes.
He can walk. Look,
15 minutes neuromodulation.
It's okay. Look.
Of course, it's a short-term potential,
Automatically heights.
but you can see him, no assistance,
No vestibular. That's the program. This is the key.
and we are targeting
Look.
that region of the brain. We're targeting basically P3 anode. There you can see it there, and also PZ.
You understand now, huh? What's happening?
These are the default mode. As we say here in Cyprus and Greece, a man needs a little bit of madness, or he never dares to cut the rope and be free. I know the word Thailand in your country means a land of freedom. That's why it means Thailand, land of freedom. And we need to free these people from the misery. As Steve Jobs once said, the ones who are crazy enough to think that they can change the world are the ones who do. And I believe this as well here at Sozo. We are leaving now from this phase of our evolution as a Homo sapien with our human language. Our species has been around, Homo sapien, for 250,000 years, plus or minus 50,000 years. We are now in a state of civilization. We are state in communication from cognition. We are now in communication. We're using now AI, and we're in a different phase for our neurobrain capacity. As you can see, AI started from 1642. If you look at all the evolution coming through, it started from the French mathematician and the inventor, Blaise Pascal, and the recent one that most people know about artificial intelligence is Edward Feigenbaum. So at Sozo, we are using now AI systems, both monitoring and both targeting.
Right. So it's like do nothing. So we have
So
to
it's very important to know where to map
with the track.
and where to target as well. Our brain is not designed to make us feel happy. Our brain is designed to adapt, to change. As we know from one of my good friends from Stanford University, he is an evolutionary neurologist and neurobiologist, Professor Sapolsky, who talks about hard determinism. Our brain is designed to adapt to our environment. It can be our work, our wedding, our children, our income, our bank loans, and all that. From a system of emotional to a system of high thinking. Now we are going to this phase, artificial intelligence. As we know, 3.5 million years is what lizards have, the reptilian brain, dinosaurs. This is what horses have and all mammals, our limbic. As you know, most of the transmitters here are dopamine and serotonin, especially with Parkinson. This is our executive, our neocortex, our rational thinking, frontal lobe, and now we're storing everything externally and bringing everything externally, which is AI. And a prominent professor talks about it, the Homo Deus, Professor Yuval Noah Harari. Now, this is a patient we treated with Neuronica. Now, what has Neuronica got to do with a severe psoriasis patient? She has psoriasis, which has been confirmed by her rheumatologist for the last 9 years, but now she has psoriasis of the skin. She's consulted over 8 dermatologists. She's done skin sampling, but nothing is working. Now, if you look in the environment under the skin, you will see there's TNFA factors, interleukin factors, macrophages, and you can see these are all the humoral cells. Th17 we know is also involved in multiple sclerosis, and also you can see the other. So what we're trying to do is from the brain, the cortex, okay, is to stop this neuroinflammation on the skin where we have the psoriasis. It's the psoriasis. The patient has consulted multiple specialists, as we said, over 8 dermatologists here in Cyprus. She also flew to a European country in Germany, but they could not give her anything more. She's taking constantly Zithromax, which is basically antibacterial, it's basically antibiotics. She's taking Dexamed, as you know, it's cortisone, low dose, and she's taking local creams, but nothing is working. All her skin is full of psoriasis. You can see here, it's in her abdomen. This is her abdomen. It's in her arms. It's in her lower limbs. It's everywhere. So we decided to use Neuronica. We were targeting the cortex. We were targeting the primary sensory region, which maps the whole body, the homunculus brain. And we were targeting the carotid sheath and basically the spinal tracts. The vagus and the spinal tracts. This is only after 6 sessions using a 2-channel Neuronica. Only after 6 sessions. This, what you're seeing here, is in 3 weeks. And she is still symptom-free. This patient came to us roughly 4 months ago. That's her using the Neuronica device, the tDCS stim. We are using now here 2 channels, anode and anode, the primary sensory, primary motor, and cathode, we took it all the way down to the sacrum, to the plexus. You can see how her arms cleared as well, how she was before and how she is after. And from there, this one is a miracle. I will show this case, what you can do with neuromodulation here at Sozo, using Neuronica devices. So this lady came to us in 2019. She is from South Africa, living in Cyprus for an offshore company, and she started to develop numbness, tingling down her lower limbs, from here and down. They did an MRI for the brain, they did an MRI for the cervical spine, they did an MRI for the lumbar, but they didn't find anything. They were suspecting she had MS, multiple sclerosis, but her proteins came back negative from the CSF. She came to us in 2019. She had an unsteady gait and severe pain. When I did the reflexes here, they were normal. When I did the reflexes of lower limb, they were hyper. When I did Babinski test, it was positive. And we discovered a tumor. No one basically found the tumor in the thoracic spine. This is called an epididymioma. Usually it lines areas of the cranium and also the spine cord. This tumor does not respond to chemotherapy, does not respond to radiotherapy. It needs to be removed. It's a very lengthening operation. If you speak to our neurosurgeon, Dr. Andreas Christopoulos, which is our medical chief, this surgery can even go up to 12 hours. You have to be very delicate to remove the tumor, to salvage a bit of grey matter, so the patient has some form of motor or sensory. Unfortunately, there's the tumor. There's almost no grey matter left. It is at the region of T1, going all the way down to T3. The patient now is paralyzed. She was informed she will be paraplegic and she might have chronic pain, which she does. She has no sense of bladder, no sense of bowel control.
It's got 2 weeks now. We've been stimulating the brainstem.
And this patient came to us after 4 years because she had chronic pain. This is how the tumor is in the spinal cord, and that's how it is removed. So imagine now her ventral horn tracts and the dorsal horn tracts are affected. She has constant pain, and very, very little movement at all. No movement. She is paraplegic. So at SOZO, we decided to use Neuronica, the 2-channel system, and we started to get her first results.
And what's going on pain-wise? Pain-wise, with the juices.
It's been reduced. The little pain that I did have has been reduced.
Her pain has been reduced.
But otherwise it was comfortable and manageable.
Okay, and this is the miracle.
Okay, leave her alone. Open your legs.
Her neurosurgeon, when she went and consulted again, said this is impossible. This is unachievable. There is a device now, non-invasive. I'm not going to mention it. It's worth $40,000. It's past FDA. It only uses spinal stimulation, external. What we're doing now with Neuronica, we're going to be using it on a new study for spinal cord injury people. We're going to be combining our study with Turkey and our study with America, USA. These are 2 functional neurosurgeons, and we'll be using Neuronica device. Now, look at this patient. She is actually walking. How did we achieve this? Motor control.
Balance. Leave her alone. Open your legs. Okay.
This is only in 3 months. That's the gift she gave us. We are an Orthodox Christian country, so she gave me St. Peter, which happens to be my name. There is the tumor. It's been